What it do, Dream Team? It's your boy D Neal back with another reaction video, guys. Here we are with how Medicare for All works in Australia. I'm very intrigued to hear about how it works because you hear a lot of great things about the Australian healthcare system, of course no system is absolutely perfect, but it seems like Australia's really figured it out. A great system for all of their citizens. So I'm very intrigued. Before we jump in, make sure you subscribe to the channel, ring notification bell, give the video a thumbs up so it gets suggested. What we got?
The 2020 Democratic primaries are in full swing as the candidates argue over the best way to approach policy. One of the biggest policy divides: the role of private health insurance.
We have got to pass a Medicare for all single-payer system.
Private insurance is not working for tens of millions of Americans.
The quickest, fastest way to do it is build on Obamacare.
Many countries around the world provide government-funded universal health care while offering secondary private insurance. One country that's frequently overlooked? Australia. So how well does Australia's system work compared to U.S. healthcare?
Talk to me.
In 2017, Australia is estimated to have spent 9.2% of its GDP on healthcare, while the US spent nearly twice that at 17.1%. In other words, Australia spends about $5,000 USD per person, while the US spends over $10,000.
That's crazy. Health spending per person. We spend over double the amount per person. That's crazy.
Despite spending about half the money, Australia has better or comparable health outcomes to the US. The average life expectancy in Australia is 4 years higher than the US, and Australia's infant mortality rate is lower. Additionally, the maternal mortality rate in America is nearly 5 times higher than in Australia.
God dang!
Australia's healthcare system is sustained by a publicly funded universal health insurance network called Medicare. Australians can also purchase private health insurance to cover hospital treatments or services that Medicare doesn't cover, such as dental or vision. But private insurance in Australia isn't meant to replace Medicare.
I think it's a bit of a given that if you make above a certain amount, you just have to kind of hold your nose and buy in.
That's Dr. Elizabeth Bates. She's an American who now lives and works in Tasmania, Australia. She did her medical training in both countries. For full disclosure, Dr. Bates' husband worked with the Australian government to help digitize citizens' health records.
I hear more from people that are going through the public system a bit of, well, even if I'm not a private patient, ... So there's always that fear, I think, that people won't be treated as well, which I don't think really plays out.
Most Australians with private insurance receive a government rebate to help cover their monthly premiums. Also, if Australians purchase hospital coverage before age 31, they avoid an extra charge on private insurance premiums for the rest of their lives. Under Australian Medicare, doctors can set their own prices. However, many follow the Australian Medical Association's list of suggested fees. If a doctor charges more than the Medicare standard fee, the patient is responsible for the difference. These out-of-pocket costs are known as a medical gap, similar to a copay in the US. So how does this healthcare scheme...
So yeah, like if a doctor decided to charge more, then you would have to pay the difference, but it seems like most of the doctors there charge the suggested fee, and so you really don't have to pay. And there is the option, you do have the option for private health insurance for certain things such as dental and vision. But the Medicare for All system, it seems like it works great, and there's not really a difference of how you're treated, whether you are in the Medicare for All or whether you decide to pay for private health care, which I absolutely love that.
Stack up against the US when it comes to the chronically ill patients who use the system the most. Crescenda Keith, an American citizen, and Kirsty Wilkinson in Australia both live with a rare condition called Ehlers-Danlos syndrome, which is also known by its initials EDS. The symptoms can vary in severity depending on the individual, making it difficult to characterize.
It's a continuum. Some people have it to where it doesn't affect their day-to-day life, and some people I know are completely bedridden.
Crescenda has changed insurance statuses several times over the years, going from private insurance that offered comprehensive coverage to no insurance to the government-funded system for low-income Americans called Medicaid.
Going through with the private insurance, it was incredibly easy to get something as simple as a geneticist to diagnose me as opposed to a primary care doctor and a rheumatologist. which was amazing. And it actually, because I had racked up so many bills trying to figure out what was going on, that the geneticist, I had no copay, no nothing.
But Crescenda ended up going from having private insurance to having none at all.
To go from that to having nothing is shocking. I did better waiting until I was so sick that they had to admit me to the hospital.
Jesus.
And seeing the specialists in there and just racking up those bills, which the hospital ends up writing off anyway.
After a few years of being uninsured, Crescenda was able to get on Medicaid after a long process with a lot of bureaucratic hiccups.
Finally, recently I was approved for Medicaid, which I thought was going to be the best thing ever. That opens the door to a primary care and opens the door to specialists. The specialists are not even in the area. You give me an hour drive to get to a doctor, that's absolutely inaccessible. And at that point, you're kind of like, well, I wish I just had no insurance, because that little aspect of hope is sometimes worse than accepting the fact that you have no hope. We're looking at
Jesus, that's absolutely awful. So know what I'm saying? From the being privately insured sounded like it was good. Got in, got to see the people she needed when she needed to see the people, to being uninsured to where she basically just waited till she was so sick she had no choice. Like, they had no choice but to see her in the hospital. They treated her. And then going to Medicaid, where it's like, well, now you got to go find a doctor that's in your area, in your system or whatever. And you're talking about an hour-long drive to go to the hospital just to see somebody. Because, I mean, a lot of places don't have the specialists and everything, I guess, that she needs for her conditions. With being on Medicaid, she can't go to certain places that are out of network, I assume. And so that's insane. So she's like, honestly, it's just better to have no health insurance than to be on Medicaid.
Into filing bankruptcy. Because a lot of the medical bills, even though I was low income, for some reason they still went to collection, even though I contacted people. Even some of the medical bills from when I had good insurance, where I was supposed to have no copay, are now in collections because I didn't know about them and I was moving.
Oh, wow.
By comparison, Kirsty's insurance coverage has been more consistent over her lifetime. She chose to buy private insurance to help cover her expenses. She thinks that investing in private insurance in Australia is worth the extra cost for convenience and peace of mind.
For me, while I'm in private, is you get choice of doctors.
Okay.
Choose when you have treatment, which is a big plus, because in the public system, you can be waiting months. If I didn't have private cover, I think I'd be up for a lot more. Because what some people say is that you should just put the money aside, but the thing is, you don't know what's around the corner.
I'm a huge fan of universal healthcare coverage, but nothing in this world is perfect. If somebody's got an acute problem here, they can get in very quickly, but if it's just sort of a just-in-case safety check, there's a very long wait through the public system, and that makes me nervous, because we know the reason we do universal screening is somebody out there's going to have a cancer sitting there quietly, and I would really like them to find that out before it causes a problem and spreads.
Kirsty finds that while her
I see what you're saying. So she's saying in the public system, it's like, if you have like a serious problem, then you can get in almost immediately. You know what I'm saying? Of course, you're going to be seen, but if it's not serious, like, you could wait months before you could be seen for screening or something like that. It sounds like an Australian healthcare system. And so she pays for private healthcare system, where she pays extra, but she gets the treatment whenever she needs the treatment. She's not waiting months until something does happen, and she absolutely needs the treatment. You know what I'm saying? It's like you're being proactive instead of reactive. If that makes sense. That's what I'm getting right now.
Costs may vary depending on her physician and treatment. Some of her doctors take into consideration that she's a long-term patient on government disability.
Because I'm on the disability support pension, and the hospital I go to, generally, they actually bulk bill. And the clinic I go to for my MRIs on my knee, for example.
When doctors accept the Medicare standard fee, so patients don't pay anything out of pocket. Oh, wow. That's amazing.
Example, they actually bulk bill because I'm referred by a specialist. It really depends on,
Wow.
I think, your doctors in terms of how much they charge you. I mean, there are doctors out there who charge a lot more than others.
Americans and Australians tend to have many of the same opinions surrounding the effectiveness of their healthcare systems. Around 45% of people in both countries are concerned that their medical costs will increase over the next decade. There are some differences, though. While both Australians and Americans rank the cost of accessing treatment among the top 3 problems facing their country's healthcare system, only 38% of Australians felt that way, as opposed to 64% of Americans. Australians were evenly split on the biggest issue between cost, staff shortages, wait times, and an aging population. A big difference between the countries is that only 4% of Australians feel that their country's healthcare system needs to be completely rebuilt, while about 23% of Americans feel that way. Crescenda and Kirsty's experiences show that both the American and Australian systems have their problems. But the Australian system does offer more consistency thanks to basic universal coverage.
I think, we're really lucky to have the system we have in Australia. I think Medicare does make it, even though you might only get half back or whatever when you're seeing doctors, at least you get something back.
Yeah. Nah, I completely agree with that. So yeah, it sounds like I said, there's no system in the world that's going to be absolutely perfect. Every system is going to have their problems. It just seems like here in America, we just have so much more problems than many other countries when it comes to healthcare. Yet we're spending almost twice as much as many other countries when it comes to healthcare. So it doesn't make sense. That's all we got. You guys got a favorite video suggestion, you can subscribe to Patreon or drop it in the comment section. It's your boy D Neal. Out.